Hello, this is Dr. Bertha. Thank you for joining my channel. And in this video, which is part 3 in English of the series on lupus, raising awareness, I'm going to show you the other signs and symptoms that patients with lupus can develop. I'm going to be looking at the gastrointestinal tract from your mouth to your anus. I will look at the kidneys. We will look at the blood system and also look at other areas where lupus can involve. So there's a phenomenon called Raynaud's phenomenon, which occurs in quite a few autoimmune diseases. It's a condition where people go out into the cold and their fingers get blue and cold. And it's, again, the same immune deposits. This antibody attacking the abnormal cells and giving rise to so much pain and discomfort. Patients with lupus, after they start taking medicines, will look like you and I. There's no way of telling, and yet they're going through a personal battle every day. So I want you to watch this. If your family member has lupus, that you can understand them. The life is a struggle, but they're doing their best to get along. So talking about the gastrointestinal system, in medicine, the GI system refers to anywhere from the mouth to the anus. So let's talk about the mouth. Lupus patients can develop ulcers on their tongue. These are painful or painless ulcers that can occur anywhere in the roof of their mouth and their tongue. Now, even in the nose, you know, when we section your body in two, even though your nose looks nice and small like this, all this big cavity is part of your nose. And so they can get nasal ulcers. Down in the esophagus or the feeding tube, this small tube, patients with lupus can have difficulty swallowing. They feel like food is stuck. They can get esophageal dysmotility. And then I'm going to show you the stomach. So patients can have type 1 diabetes, where it's an autoimmune disease affecting the pancreas. In lupus, because it's systemic, the patients can develop pancreatitis, maybe not diabetes per se, but lupus patients can develop pancreatitis. This is a model of the stomach. And I just wanted to show you that lupus patients can develop ulcers, abdominal pain, and also the same issue of what we call serositis. It's a new term I'm sharing with you, where the serous membrane, the lining of the heart, the lungs, and the abdomen can get inflamed. That can happen in lupus as well. So with this same concept of immune complexes, these big arteries supplying the stomach, pancreas, and duodenum, or the small intestines, can all get blocked. Guys, it can. And when it does, patients with lupus can develop abdominal pain and have been found to have ischemic bowel or ischemic colitis. Essentially, this bowel or tissue dies because there's no blood supply to it, and it hurts. Patients with lupus can also develop liver enzyme elevation and even cirrhosis of the liver. So the liver sort of sits here under the lung, and so this liver can get inflamed. The same ischemic colitis can affect the the large bowel, and so patients with lupus can have blood in their stools, and then they also complain sometimes that they are nauseated, they're vomiting, they can't keep food down, all affecting the gastrointestinal tract. So I think enough said about that. Let's go to an area of lupus that is of great concern, because sometimes by the time we find a patient has that, it's too late, and too many patients end up on dialysis and they die, which makes me question sometimes this whole preclinical phase. If we could find ways of determining that, that preclinical phase, if the person has one thing, maybe they should get on treatment. Why would we want to wait till they have 4 organs damaged before we consider them as having lupus? So the kidneys, when you take behind the intestines lies the kidneys of the body. They're a pair of organs which basically acts like sieves in the body. They get rid of bad substances or substances that we don't want. They excrete them and they retain others. The kidney is important in what we call acid-base balance and so forth. Now, in that preclinical stage where patients have antibodies or maybe very early lupus, just a rash, it's been found that when they take a biopsy or a chip of the kidney, it already shows abnormality. This is your kidney. This is how the kidneys look. On top of the kidneys, you have adrenal glands, which in itself can be involved in autoimmune disease called Addison's disease. That's a whole different thing. But the kidneys excrete urine, filter out the blood that comes to it through these big arteries. It filters it, it enters the veins, and then the urine goes through these ureters down into the bladder, and it leaves through, and then we urinate out, whatever it's filtered. So there's a huge problem if the kidney doesn't work. Now the kidney is made up of a cup, a little cup shape, out of which the blood is filtered. It goes into these tubes, it gets convoluted, and then it comes out. And then you have these vessels or arteries that enter the kidney. Now, when a kidney is affected with lupus, which we call lupus nephritis, all these 4 areas are affected. It spares nothing. It's affecting the arteries, it's affecting those cups called glomeruli, it's affecting the tubules, and it's affecting even the interstitium. And so there are 5 stages of classifying the kidney disease based on when the scientists or your doctors take a chip of your kidney. So I want you to look closely at the kidney and how it looks like. I'm just going to take this piece off so that you can appreciate what a section, or maybe just bring it close so you can see what a section through the kidney looks like. How do you know you have kidney disease? So sometimes you might not know. Other times, your doctor can do a simple urine test, and when they find protein in your urine, which is called proteinuria, then you're having some kidney disease. Sometimes it will call for collecting a 24-hour urine to measure to see whether you have more than 3 grams of protein. Other times the urine can just froth. You would urinate and it looks like the urine is foaming. Sometimes there's blood in the urine when those glomeruli are affected, those little cups in the kidney. And so all those are signs of liver disease. But when it's really advanced, people find that they have puffy feet. So if you have a young person, 21-year-old, who has puffy feet or maybe slightly puffy face, it just means that they've lost protein in their body through the kidney, and that's why their feet are swollen. So that's the kidney. Then let's talk about pregnancy, or better still, let's talk about the blood. So these are red blood cells. If we take a little bit of your blood, floating in it, you'd have what we call red blood cells, white cells, and these little things called platelets. They're all happy going along. These red blood cells are supposed to carry oxygen. These platelets help your blood to stick together and form a clot. And these white cells are the soldiers. A bit of them are what I showed you, the B cells and the B cells and the T cells. They're all happy until lupus comes along, and guess what happens? So a couple of things can happen. Lupus starts attacking these red cells, and they can cause what we call hemolytic anemia. Your blood cell is down because these antibodies are attacking your red cells and breaking them up into little bits. Some people also develop anemia simply because they're losing iron, either because they're having blood in their stools, or just what we call anemia of chronic disease. It does the same thing to the platelets. These things are supposed to make your blood clot. Platelets would be attacked, and sometimes it's called immune thrombocytopenic purpura, or just sometimes your platelets are just low. and your white cells can also go low. Finally, in pregnancy, so people have asked, if somebody has lupus, can they get pregnant? Of course. Lupus patients get pregnant all the time and have normal babies. What can happen with a subset of lupus patients though is that some of them, 5%, they can transmit, or better still, the baby can develop lupus in the womb. And so after about 6 weeks of giving birth, the baby can develop a rash and they have neonatal lupus. The dangerous thing about this is that the babies can develop heart block, and if their hearts are not working, they can die. A pregnant woman can also develop preeclampsia, where there's so much high blood pressure within the placenta, they're leaking protein in the urine, and it becomes difficult to determine, is the protein leak occurring because they have kidney disease or because they have preeclampsia. Then there is a subsection who have what we call antiphospholipid antibody syndrome. They also have miscarriages because they tend to clot all over. So in a nutshell, I've talked about some of the signs and symptoms of lupus. I'll see you in the next video.